Welcome to the Unapologetic MidLife podcast, and thank you for coming back. And today we are here with a special guest, Dr. Gregory Loewen, DOFCCP. Welcome, Gregory.
Thank you.
Thank you
Great
for being
to be
here,
Mindi.
We're excited to have you. So let's hear a little bit about your stories.
I started in this medical field as a pulmonary critical care doctor, and I've done that for a lot of years, maybe 30 or 40 years. And I used to be the head of the pulmonary department at Roswell, and I was working in the field of lung cancer primarily, and I enjoyed my work a lot, but I had another interest, and that was mental health. And in fact, I started my medical career by beginning a residency in psychiatry, and it was always kind of the road not taken. I finished my first year of psychiatry and then switched to internal medicine. And so I always thought about maybe returning to the field of mental health. And I would say probably about, maybe 4 years ago, I read the book by Michael Pollan, How to Change Your Mind.
Yep. That's like the book that leads people in to start asking more questions, I feel like. And then the Netflix documentary, right?
Yeah. And the book was just so powerful. I read it again. And then there was a light bulb, and I thought, I know what I want to do with the rest of my life. And so I enrolled in a fellowship in psychedelic medicine. This fellowship was in the Integrative Psychiatry Institute that's located in Boulder, Colorado. And I worked for a year to gain training in doing therapeutic sessions with psychedelic medicines like ketamine, and we also had training with MDMA and with psilocybin. I happily joined this revolution that's taking place in mental health, and was able to return to the field that I originally loved. And I have never been happier in my life, and I've never felt more of a sense of meaning, I think, with my work than I do now. I mean, I will say that in all of those years as a lung doctor, mental health was still a major part of my practice. I constantly dealt with end-of-life issues because I was taking care of people that had lung cancer and COPD and pulmonary fibrosis. And we also dealt a little bit with addiction medicine because there were many that were hooked on cigarettes, and that was kind of familiar territory for me. So I think that I had a lot of experience, let's say, taking care of counseling and interacting with people, much like what I do right now, and so in many ways it prepared me for my role that I'm getting to play.
Yeah. I think of the world of cancer, right? And you're dealing with people, like you said, addiction. People are really sick. It prepares you, I feel like, for the unimaginable. And tying that into psychedelics, I mean, you're helping people potentially work through their own traumatic experiences, maybe addiction. These medicines, they're not things that have just gotten onto the market, right? These are also things that have been around a really long time. But we're starting to see a shift in, I think, societal perspectives. And maybe SSRIs are not everything, or maybe there is more to this. Psilocybin, MDMA, the benefits that come from this it's wild.
Yeah, I agree that it's really striking. I think we're in the middle of a societal shift and
like a revolution of thought and perspective.
Really, and in the field of mental health. And I think one of the backdrops that's really powerful that I relate to and that I see for my own practice is the relationship between trauma and the things that have been labeled as mental health diagnoses. So many things that we have struggled with, let's say, and that I have personally struggled with as a human being too,
Mm-hmm.
depression or
Mm-hmm.
anxiety
Mm-hmm.
or addiction, or
Yep.
can be manifestations of underlying trauma. And that's also been a very profound interest of mine. And
Same.
in fact, I published a book about, it wasn't about psychedelic medicine, but it was about a kind of experiential personal work, you might say.
Mm-hmm.
And it's called The Unexplored Room. And it
Mm-hmm.
literally is about my own personal experiences with trauma and about doing experiential therapies and how that transformed my life.
Yeah.
And so this has a very profound connection with the very things that make me tick.
Yeah. Yeah. But that's what this work is about. I think deeply understanding the work that you do in this realm. This isn't just like you're in a lab and you're disconnected. Like, I think that personal journey that connects you to this is so powerful.
There's a model in medicine that's named after Sir William Osler.
Okay.
And the Oslerian model is the idea of being in a white coat and being objective
Yeah.
as a and being as a scientist and looking at the patient as sort of like your science project.
Mm-hmm.
And that's basically what we're taught in Western medical school and what I was taught.
Mm-hmm.
And, what's interesting is that in the field of psychedelic medicine, there's a completely different sort of model. And that model isn't about objectifying the patient. And instead, the model is about identifying with the patient, connecting personally with the patient, and even sharing personal information and insight. One of the ethics, let's say, of psychedelic therapy is that those of us who are doing psychedelic therapy are expected to experience it ourselves if we're going to give it to other people. Now that's quite a bit different
Oh, yeah.
than my work as a lung doctor.
Yeah.
I was never expected to try albuterol or
Mm-hmm.
inhalers myself before I prescribe them for people,
Yep.
right?
Yes.
But this is a kind of, oftentimes I will tell patients, I'm part doctor and I'm part Sherpa, you know, and because my job is partly to be your guide, to support you as
Mm-hmm.
you go do this journey and do this kind of work. And I think that's another paradigm that's shifted. So one of those
Yeah.
the paradigms is that those of us that do this kind of work, as we have done it ourselves. So we draw on our own experiences as we help people go through this. And
Yeah.
I think another really important point is that, in a lot of, let's say, medical treatment,
Mm-hmm.
and certainly in mental health treatment,
Mm-hmm.
the expectation is that, you go to the doctor or you go to the nurse practitioner or whatever, the health professional,
Mm-hmm.
and you tell them your problem, and then they give you a treatment. They give
Mm-hmm.
you a drug,
Yeah.
and the drug is used to treat you. And
Yep.
maybe you have side effects, or maybe you don't, maybe you can tolerate it, maybe it helps, maybe it doesn't.
Yep.
But you're going to that person and they're giving you something. Psychedelic therapy doesn't exactly work that way.
Nope.
Psychedelic therapy is like a form of personal work. And, that was really what my book was about, The Unexplored Room. It's
Mm-hmm.
about going inside and saying hello to this material that we're all carrying
Yep.
around,
Yep.
you know?
Befriending it.
It, yeah. So this is really not about me giving you something to
That's not already
fix your
in you.
problem.
Right.
It's about me, providing support for you to go inside and do a kind of personal work.
Yeah.
And
That
my
personal
job
work is so
my job
important.
is just to sit with you and to support you and, to provide, to be a witness for your work, which, can absolutely change the work,
Yeah.
I mean, and that's been my experience is that the people that have been there to support me to do this kind of work have really changed my life.
Yeah. Do you mind sharing what some of your experiences have been.
No, I don't. So I am I think one of the experiences that shaped my life from an early age was that I was adopted. My biological father was in the entertainment industry.
Mm-hmm.
Was famous person
Mm-hmm.
in Los Angeles, and my biological mother was an editor at the television station
Mm-hmm.
where he worked, and they were each married to someone else.
Okay. Yep.
And and the setting was 1957.
Very
So
different time. Oh yeah.
this is a time a long time ago
Yep.
when it was really deadly
Yep.
for someone to be scandalized in an
Mm-hmm.
extramarital affair.
Oh yeah. And a
And
public
this
person
is
at
the
that.
thing that right,
Yeah.
it ruined careers and stuff. And
Mm-hmm.
so they each had children of their own with their
Families. Yep.
primary spouse. So when I came along, I was a scandal. Um and they talked about staying together, but they decided that it was best to not do that. And he provided her with some funds, and she left Los Angeles and moved to Washington, D.C. with my two other half siblings, and kept me for about 9 months,
Okay.
and then decided that she might be able to reunite with her husband if she gave me up. And so I got voted off the island at an early age.
Yeah.
And I was adopted by two wonderful people. They were, teachers,
Okay.
college teachers, and, you know, quite conservative and religious, wonderful home. And
Okay.
I came into a very supportive environment, and as an only child. And you might think that, well, that's like an ideal ending, right? It's like, why would that be traumatic? I mean, in many respects, that's kind of the way my adoptive parents looked at it.
Right. Right.
We've given you everything you could
Yep.
possibly need. What?
They didn't see that extra room.
Right. They didn't see the unexplored room.
Yep.
And so I grew up and I went through school, I went through college and medical school, and
Did
was
well for
into,
yourself. Yeah.
starting into early training. I was in my residency, and I had developed a problem with addiction and alcoholism.
Mm-hmm.
And it was something that was the struggle recurred. I've got treated for the first time when I was 24, and I stayed sober for a year or two, and then relapsed and relapsed again and relapsed again over and over 10-year period. And what finally turned the corner for me was doing a kind of experiential work where I looked on the inside and I said hello
Mm-hmm.
to the hurt
Yeah.
that had
Instead of trying to
happened
suppress
before I
it.
even had words.
Yeah. Yeah.
I said hello to this idea that I was actually angry with my biological mother for letting me go, and
Yeah.
hurt.
Yep. It's trauma.
And
That attachment. 9
yeah,
months. I mean, it's hard enough for a child right from birth, but 9 months, you already had attachments formed.
yeah, and so there was all the attachment material, and then another big piece of it that I learned about later as I did psychedelic work, in the not too distant past,
Mm-hmm.
was there's a lot of fear.
Abandonment.
I was actually terrified, and it wasn't because I was treated badly. It was just because my mom was gone and my brother and my sister were gone.
Yeah. Yeah. I mean, essentially, you were abandoned, even though you were taken care of and you were adopted. But those abandonment wounds, it stays with you. And I'm assuming did you know you were adopted growing up?
Yeah,
Okay.
I did,
Okay.
and but I didn't really learn about the details of my origins and that part of the story until I was probably about 16 or so.
Okay. Yeah.
16 or 17. But I will say that, this whole thing is like these early traumas are kind of like the skin of the onion, and you peel one
Mm-hmm.
layer off and you get down another layer
Yep.
and you peel another layer off. But what was really important for me was that, that there was a moment where, the first time I did any kind of experiential therapy, it was with a program that's run by Karen Foundation. It's
Okay.
called the Family Program. Basically, is a trauma retreat it takes about a week or so that they do
Okay.
for codependency. And one of the exercises, it was like in this little chalet in the mountains of Pennsylvania, and there was like 12 clients and 6 therapists. And one of the exercises was this kind of a psychodrama thing where a young woman who was one of the other participants played the role of my biological
Mm.
mother. And I faced her,
Oh,
and I became that little 9-month-old boy for a few moments.
oh,
And
oh, yeah.
I cried for the first time and said, "You left me in a house of strangers."
Yeah. Yeah. You needed to mourn that. I mean, how do you grieve at 9 months? You don't know how to grieve at 9 months. Adults don't
And
know how to grieve sometimes, you know?
And when that happened, in that moment, my head for the first time connected with my heart. It was like lightning
Yeah.
struck me. And after that happened, I never drank again. That was the moment that I
Wow.
really started to connect with my own interior. And
Yeah.
that's kind of what my book was about. And that moment of connecting with your interior is a moment that many people find when doing psychedelic medicine. Psychedelic
Yep.
medicine isn't the only way to do it,
Yep.
but it's a pathway that leads people into this profound kind of self-exploration, just
Hmm.
like it did for me, where they say, aha.
Yeah. That moment of just things making sense. And I feel like that mind body connection. So often people are
Yeah.
trapped in this thinking, or they're trapped in a feeling, but it's not that feeling, right? It's not that connection, interconnectedness between mind and body. And you being a doctor, I mean, our system is very much about if you're going to go past the ankle, you got to see this doctor. Oh, sorry, it's the heart. You got to see this doctor. Like it's very segregated and separated. And I talk about this in some of my other podcasts because it drives me wild because it's all interconnected. And that's what you're saying about doing this kind of work with psychedelics, that it really returned you to a whole being. It brought everything together.
Yeah. I mean, it's certainly been doing this kind of work in my own interior has what's changed my life.
Yeah, it
And
sounds like it.
it's what has helped me find meaning, because there's a tremendous amount of meaning that, I mean, that's one of the pearls, as you know, that people take away from psychedelic therapy. When it works, it's because there's images and sounds or, memories or experiences that all of a sudden light us up. And all of a sudden we get it. We
Mhm.
understand what it all means.
Yeah.
And long after the medicine is worn off, that's a pearl that we keep with us. And
Yep.
I've been lucky enough to have that experience, and I've been lucky enough to help others find it too. And that's really what keeps me going
Yeah,
and makes me love this so much.
it's this gift that I think every person carries with them that they don't know how to tap into. Like knowing yourself, and it's always so interesting when people come to me and I don't know what I want to do, or I don't know who I am, and it's like you're searching outside of yourself for those things, and you essentially have carried the key to that unexplored room the whole time. And I feel like psychedelics end up being a mechanism of helping you get back to that room and what's already within you. And I guess this ties into aspects of the universe too, right? Some people are very much, start to notice and feel that interconnectedness of nature. And so yes, within us, but when we're looking outside of us, what kind of started to fall into place in that realm? Because I feel like nature is a huge component of this healing process too.
Yeah, it's deeply true. One of the things that I look to is that this process that we take people through when we do psychedelic sessions, it's really not new. This is
Mm-mm.
something that has been practiced by indigenous peoples for thousands of years. And the heralded Maria Sabina that many people look to as maybe one of the grandmothers. Maria Sabina, for those who haven't heard of her, she was a medicine woman, a healer
Okay.
in Oaxaca, Mexico,
Okay.
who
Indigenous.
indigenous, and who uh, basically came to light because of an article around 1957, I think,
Okay.
in Life magazine, um, that highlighted her and her work.
Mhm.
The words that that she's credited for why people would come to her to take psilocybin mushrooms to do a
Mhm.
journey in this kind of personal work that she did. Her words were to find the thing that's missing, to
Mhm.
find the thing that's been lost. And that resonates for me because I think that that's what I find when people do this kind of work is
Yeah.
we all find these missing pieces of ourselves.
Mhm.
And I guess that's part of what I think of when I think of the natural part of it, and certainly nature is a part of it. And one of the things that when I'm discussing a journey, you probably do this too. We are in parallel paths,
Mhm.
obviously, because
Mhm.
as a therapist, you're doing these sessions as well. But oftentimes, I'll tell patients to try to give yourself a spa day.
Ooh.
Once your session is over,
Yep.
go home. Don't talk to anyone. Don't turn on the television or the computer. Go sit in your backyard and look at the trees, look at the sky, listen to
Mhm.
your heart, pay attention to what's coming up.
Yeah.
And there's a tremendous symphony that's played between nature and the interior as we do this kind of healing.
Yeah. I think of nature, I mean, there's stuff on it, obviously, but nature's frequency is healing. But we in today's society and being such a rush, every second of the day is filled with work to get the kids and this and that. And it's like craziness all the time. And in a perfect world, a person should take like a week off after a psychedelic experience. But I know that can always happen. But to
Yeah,
give yourself a day to, at minimum, submerge yourself into nature, like you said, just sitting on the backyard. I've had people go for walks afterwards because you can walk, you can't drive afterwards, obviously, but,
absolutely.
uh, you know, really take it all in. And I've used this example before of noticing the trees on a street that I used to live on. I'd walked that street millions of times. And one day I just had noticed that all the trees were a different color. And I was in such awe of it because it was just something I was so familiar with, but had never noticed the details of.
Yeah.
How do you think these experiences have shaped your life in details? Like, what are things that you notice that maybe you didn't notice before?
Hmm.
I always love this part of it because it's a different perspective.
Right. Yeah. I don't know. It's interesting. It's a really super good question, and I haven't thought of an answer. So I'm just
It's
going to,
okay.
free associate, I guess. I think that there's a couple of things. I think that one of the things that comes up for people when they do psychedelic work frequently echoes that notion of Maria Sabina that we find things that are lost. And a lot of times what we find is we find parts of
Okay.
ourselves that we really weren't aware of. And that's one of the things that has certainly happened to me when I was, in my training. Part of my training involved uh, psilocybin, and
Experiential, right?
yeah,
Yep.
and experiential, so one of the things that happened to me was that during that experience, I had a very scary, scary thing where I was taken back to this. There was like this. I experienced this trash compactor, those things that crunch things up.
Mm-hmm. Yep.
And there were like baby crib bars crunching up, and Disney wallpaper crunching up, and Disney toys crunching up. And as I did the integration afterwards and began to understand, I
What
began
was
to
it? Yeah.
realize that what I was seeing was images that occurred to me when I was 9 months old,
Mm-hmm.
sitting in a strange crib with strange Disney toys and
Mm-hmm.
strange Disney wallpaper. And I came to realize that I was terrified. I wasn't because I wasn't receiving kindness, but
Familiarity.
I had lost everything that I knew.
Yep.
right?
Yeah.
And so that led me to say hello to that little 9-month-old part of me, right?
Yep. The part you've been
And
carrying with you all these years.
and so that's a part that I've learned to treasure and say hello to and do things for that part of
Nurture.
me.
Yeah.
Nurture that part of me. And so being aware of a part of myself, that's something that I've taken away from psychedelics that's changed me. And I think, on top of that, another very powerful thing that I've experienced and that I see my clients experience too. I'm curious if this is your experience
Hmm.
too as a therapist. And that's that in this kind of therapy, it's very common for us the word that's used medically is dissociate. And of course, for your viewers, what we mean by that is that we kind of leave ourselves and see ourselves from the outside.
Like that bird's eye view.
But that bird's eye view
Yep.
where we get above ourselves and we see ourselves separately. And, that ability to get outside of ourselves and see ourselves, that changes the way we move through the world.
Oh, yes.
That action of getting outside of ourselves and seeing ourselves, it experienced meditators can do that, but it takes them 30 years. And it takes somebody about an hour when they do a ketamine session with us,
Hmm.
right?
Yeah. So you're reducing that time. I don't know. Not that you shouldn't meditate, not that you shouldn't do
No,
that, but
no,
if we can get a person there in an hour versus 30 years, I mean, the healing is that much closer, or that
right,
journey for healing is beginning that much earlier.
right. It's just a shortcut that,
Yeah.
shortcuts are good sometimes,
Yep. Yeah.
Shortcuts are not always bad. And so that skill of being able to get above myself and say hello to what's going on,
Yep.
that's another thing that I've gotten from doing psychedelic work and doing this kind of work in my own space that has changed the way I move through my life.
Yeah.
If I have emotions that come up right now these days, if that happens, I kind of like say, I'm getting a little triggered here,
Yep.
I
Noticing it.
I'm
I'm embracing
noticing
it.
instead of
Yeah.
being in it.
Yep.
My God, you can't believe you did that.
Yeah. Yep.
You can say, I'm feeling a little triggered right now. You know,
Yep.
so
Yeah.
that quality of being able to get outside ourselves and see ourselves and notice those feelings and notice that's actually another, I think, gift of having done psychedelic work. And the one of my favorite illustrations comes from Mark Ruffalo
Okay.
in a movie called Thank You for Sharing. And he's in a 12-step recovery program, and he's
Hmm.
talking to one of his sponsees, and he's telling his sponsee that children are like emotions, and they're kind of like emotions are like children. They're like children that are sitting in the back seat, clamoring for attention.
Yep.
And he said, you 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 don't want to let them drive,
No.
and you don't want to lock them in the trunk either,
Right. But they're impossible to ignore.
but you have to pay attention to
Yep.
them.
Yep.
And he's, I think that's an allusion
Yep.
to this ability to get above our emotions and to say hello to them, and be aware of them without
Yep.
letting them take over
Yep.
and drive you off the road.
Yeah. I think that ability to sit with the uncomfortable emotions is, I don't know if it's a superpower, but it certainly is something that people can learn to get better at. And I think, as we get older, I mean, this is documented. This is not saying anything new, but we learn things early on, whether it's like how to hold back emotions or don't cry or why are you angry or don't be angry or don't get upset, or there's so much conditioning from being a child, whether it's societal, whether it's cultural within a family, but we lose some of that openness to be vulnerable. We lose some of the ability to truly be what we're feeling, like, or be a part of what we're feeling, because we're taught to stuff it or shove it down, or, as a woman, you're acting crazy, or what's wrong with you, right? Like, and men, there's societal, pressures on you guys too. Men aren't supposed to feel, and, and it's wildly ridiculous because we know that it's not true. You feel just like women do. Yeah, this work I think has been real powerful. I see men, I see women, particularly for men, though I think this work is really powerful in that it helps you guys to kind of get back in touch with parts of yourself that you were taught to suppress. And that's been really, really cool to see with people. I have obviously only done ketamine with people here because that's what's legal right now. But, you're trained with MDMA, psilocybin. I guess, do you mind sharing a little bit about the differences of those and what your thoughts are on as things hopefully eventually become legalized, especially in a medical standpoint?
Sure. Well, I would say that, there's several, drugs that are presently being studied in a research way that have been identified by the FDA as what's called breakthrough agents, meaning that they have such extraordinary activity in human beings that the bar is lowered for these drugs to find their way to market. And those
Yeah.
drugs, surprisingly, are LSD, psilocybin, and MDMA. Ketamine is a drug that's already available.
Yep.
It happens to be an anesthetic, but it has much, there's a lot of research that have documented its usefulness in mental health. So these drugs, are different in terms of their activity and their structure and even their classification. They don't really fall in the same family
But they're considered
chemicals.
psychedelics, but obviously they're different makeups.
They're considered psychedelic, but they're different in structurally, and they work on different neurotransmitter systems. But what they all have in common is they all alter consciousness. So they create an altered consciousness, and it turns out that we know a little bit more about what consciousness is these days. There have been some interesting studies that have taken a look at what happens when we're conscious. There's a kind of an MRI. I don't know if you've ever heard of it. It's called the functional MRI. And we have one, your UB. Okay. Functional MRIs not only give you this profound picture of the anatomy of the brain or whatever, but it also gives you like a millisecond to millisecond picture of oxygen use.
Okay.
So
which is interesting. Yeah.
Yeah.
How
So if
active.
you're laying in a functional MRI, and the researcher says, okay, Greg, move your right index finger. If I do that, then a little spot in the motor cortex lights up.
Okay.
And if he says, move your right big toe, another spot in the motor strip lights up. Right. And so they did a couple of studies back in 2011, 2012, where they had a couple dozen people where they were volunteers and they laid inside an MRI, and the scientists instructed them, don't move anything, don't think about it. So people were just laying there.
Okay.
And they did functional MRIs. And, when they were laying there, they did what all of us do when we're conscious.
Yeah.
They thought about their past.
Yeah.
They thought about their future.
Oh, yeah.
They thought about what had happened to them. They thought about what might happen to them in the future and the things they're afraid of. Their autobiography, that was what was running in their minds. And lo and behold, every single person had 3 spots in the brain that lit up.
Cool.
And before that study was done, nobody knew that those 3 spots were related.
Wow. So just thinking about whatever these specific areas were lighting up. Okay.
Yeah. The medial prefrontal cortex, the
occipital,
posterior cingulate gyrus, and the PCC. So these 3 spots lit up. So in all of the clients. So what they did was they realized they were looking at a piece of anatomy that they never knew. There's no reason why those 3 spots should have been connected, but they were.
They weren't moving. Nothing was moving. Just laying there.
So they gave those spots a name, and they called it the default mode network, DMN.
Yeah.
The default mode network. And what these drugs that we're talking about, ketamine, psilocybins, MDMA, what they all have in common is, get this, they turn off the DMN for a variable period of time. For LSD, it's for 12 hours, psilocybin's 6 hours, MDMA maybe 8 hours, ketamine 1 hour.
Okay. So
But
the
the
less.
effect is the same in the sense that that part of ourselves that's talking to us all the time, that's giving us this narrative,
That
the
voice in our
autobiography.
head. The
Yeah,
voice
the
in our
voice
head.
in our head that's
Yep.
telling us what we're supposed to do, that just quiets down.
That's
And
huge.
in that experience of quietness, it's possible to think new thoughts, to think of
Yeah.
things in a different way.
Oh, yeah. Ooh, that's pretty powerful. Tell us a little bit more about the default mode network, because I think people don't necessarily understand what that is. I know I'll talk about this sometimes with clients.
Yeah.
How does that tie into trauma and maybe thinking patterns?
Well, that's really a great question, and I think that is deeply tied to trauma, because what happens when we go through something traumatic is that it's recorded in our memory as you know, in a different way than normal memories. And so if we go through something, traumatic, we might only remember the sounds of something that happened. We not
Okay.
remember the whole movie of what happened from beginning to end, or might be just the colors or the shade, the textures of the wall, or maybe the feeling. And so these memories that are of trauma are recorded in a different way, and they affect the default mode network, because the part of the brain that is triggered, let's say, with anxiety and with fear, that gets really revved up. Or maybe the part of us that, if we've introjected or received and processed negative things about ourselves, perhaps,
Yep.
when we're
That negativity bias.
that negativity, that is also in the back of the brain, or the part of the DMN, and that those negative voices and things that we hear, that's also part of the DMN. So the negative voices that tell us that we're bad, the fearful voices that tell us that bad things are going to happen to us, all of those, that's all the DMN, and that's all what gets quieted down when we do this kind of work.
Yep. Which is really powerful, because a lot of people really struggle. How do I shut it off? I'm like, you physically can't just shut it off.
Yeah, yeah, yeah. And the other piece of it is that there's a guy that's a famous guy that ran some of the big psilocybin trials in the UK. His name is Robin Carhart Harris, and he was like a lead author in a New England Journal article, and he's well known. And he was one of the teachers in my program. Gave us several lectures, and at the end of one of his lectures, he said, "Okay, I'm going to tell you guys how psychedelic therapy works." And he said, "I want you to imagine yourself if you're on top of a mountain way up high, and it's a snow-covered mountain." And he said, "I want you to imagine skiing down the hill, down the trail, all the way to the bottom.
A long way.
And then you get back on the chairlift and you go clear back to the top, and you ski down the hill again, all the way to the bottom. And then you do that again, and you do that multiple times a day, every day of the week, every week of the month, every month of the year, for decades."
Okay.
And he said, after a while, you're not skiing down a trail anymore. You're skiing down a canyon. There are giant walls on either side. And he said, if you start on that trail and you start to go down, you have no choice about where you're going to go. And he said, that's inflexibility. And inflexibility is the hallmark of all mental illness.
Yeah. That ability to deviate from the go-to way of being and doing.
Right. So if you get triggered in a certain way, you're always going to be afraid. You're going to be anxious. You're going to live with hyperarousal all the time. That's part of trauma. Or if you get triggered in people like attachment and stuff, and you get triggered, I'm a worthless person. You're going to leave me. I have no value. Right. So that's what it's like to live in one of those pathways that have walls that we can't get out of.
Okay.
Now, he says what Carhart Harris says is that psychedelic therapy is like a giant snowstorm.
Mm.
Imagine standing on top of the mountain,
Yeah.
and all of a sudden there's a whole blanket of snow that completely covers up these trails that you've
Mm-hmm.
been going down.
Mm-hmm.
And so you're at the top of the mountain, and now you could go down the mountain any way you want.
Yep.
You
Yeah.
don't have to go down the mountain the old way.
Yeah.
And then the little part that I usually add when I'm telling this story is that you're not only at the top of the mountain, you're at the top of the mountain with Mindi, who's an expert ski patrol, and she's been down the mountain, right? Those of us
Mm-hmm.
that do this work, we've already been down the mountain. And so we can show you where we put our feet.
Mm-hmm.
We can show you how we've found a new way down the mountain.
Mm-hmm. There's
And so,
alternate ways.
right. So the whole idea is about interacting with the nervous system so that we find a new pathway,
Mm-hmm.
a new pathway of thinking, a new
Yep.
way of thinking about ourselves, Going back to that illustration of my own where I saw the crunching of the crib and the Disney toys and all that. The other part of that experience, as I was supported through that with loving support, is that it became clear to me that I could see my life kind of like a rainbow with little pockets and each pocket had been a place where I had been abandoned. And what turned over for me was that in one way I was abandoned, but in another way I got to be found.
Yeah. You were given a
And,
life.
and so over and over I had been found. So it was a new way of thinking.
Absolutely. That's where my
It
head
was a
went.
new way of thinking, and that was a little pearl that I carry with me today, even though the medicine is long worn off.
Yeah.
It's been years since that happened to me, but I have never forgotten what I learned from it.
I think that shows just how impactful learning other ways of thinking about situations, trying to pull in a different perspective. It's just so, so important. And I think a layer of this, and you've kind of mentioned, that 9-month-old part of yourself, but I also think of the adult part of you nurturing that 9-month-old part of self and knowing what he needed. And that gift through this work, you've been able to nurture him and help him see a different perspective and give him hope that, wow, this was okay, or certain aspects of my life were not so bad. It's that default mode network and that negativity bias isn't a neon sign any longer. Now there's this other way that is like, it's like the light bulb going off.
Well, it's a form of healing,
Absolutely. Yeah.
And, I think that just like if we go and get a laceration and, even though we might get stitches, the body, it's not the stitches that heal us up. The body has the capacity of healing scars.
Yep.
And the mind also has the capacity of healing. And so my take on it is that turning off the default mode network for a period of time, maybe an hour, and allowing new ideas to generate, new ways of thinking about ourselves, new ways of thinking about our interior, that's an opportunity for healing to take place.
It's very powerful.
That can really change the way you move through your life.
Yeah, I think that's what's so cool about this work is it's very different. Like, I do EMDR therapy, and I believe all those therapies are very helpful. I love doing EMDR with ketamine because it helps to open some of those doors and see how interconnected all of our stuff truly is in our life. Because some people are like, well, I don't want to go back to the early stuff. I just want to start with the stuff now. And I'm like, well, think of this as like a complex roadway. You have to start at a certain point and you see how interconnected it is, right? And it's really cool to do that work and see people have those moments, the integration, same thing, making sense of their experiences. I don't know. I feel like how excited people start to get and having hope of like, I can do this. It's really mind blowing. I feel like every time I go into it, I'm like, okay, well, let's see. Because there's no like set way to like do the integration. It's very much like, it's very client led, and yes, you're helping them, but you're truly just giving space to somebody when you sit with them when they journey. And I know ketamine is a much shorter journey, through your experiential. I don't know if you had the opportunity to sit with other people going through like MDMA, LSD, or psilocybin. It's a much longer journey, correct?
Correct.
Yeah.
Yeah. And I mean, I think that in terms of systemically, it's going to be maybe a little bit more challenging
Yes.
for this to be adopted into routine mental health practice.
Mm-hmm.
But I do think that's ultimately that's where we're going for at least a lot of stuff. And yeah, so yeah, it does take a little. So I don't think that. I think ketamine is a really a wonderful drug when used in the right way. I
Yep.
mean, it has precautions, and we're certainly I'm very, very careful with it, especially, being a person in recovery,
Mm-hmm.
I'm very, very cautious about the potential of addiction and that sort of thing. But having said that, I really I think that even once these other medicines, if they get approved and they're still available, I still think we're going to be able to use. I think we're going to want to use ketamine at times
Of
because
course.
it really provides a special experience that helps people.
The duration, yeah. I think it's accessible, right? 3 hours for a session. A lot of people can find time to do that, right?
Yeah. Yeah.
Yeah, my hope is that obviously there's got to be parameters around it and it has to be safe. But I know, obviously, working with you, there's options for ketamine too, right? I know people get nervous about that, but, doing intramuscular injections, especially for somebody if they're dealing with addiction versus the troches, it's very safe. They're not going home with anything. It's out of their system very quickly. It's a great option for people who are nervous about that, or if there's any risk with addiction.
Yeah. That's a wonderful point, and it's something that I'm very sensitive to, and I carefully evaluate person's risk
Mm-hmm.
before we offer them therapy. I have basically two hats that I wear professionally, and one hat is that I do medical clearance for people to have ketamine-assisted psychotherapy. And that hat, I'm an internist, and I go through their entire case to make sure it's safe for them to do ketamine, and then we try to figure out what form would be the safest if that's the case. And then the other hat that I wear is that there are times where I actually play the role of, a psychedelic assisted therapy person where I provide the ketamine and sit with a person and then do integration with them afterwards. And that's separate. But as we've worked together, which has been delightful. And
Yep.
so I provide that medical support while I have another therapist that's, sitting with the client and working with them. So.
Yeah, it's fun to be able to do the integration, I feel like, as the provider. I think about a lot of times, too, in other kind of medical dynamics, specifically, I guess, psychiatry. It's kind of like, okay, here's your medicine and you're on your way, where this is very different from that. Yes, you can be a prescriber, but you can also do the integration with them.
Yeah, it's an honor to be able to do it, and I think that one of the biggest features of doing this kind of work is vulnerability, and it helps if you're able to show your own vulnerability.
I agree.
If you're wanting a client to be vulnerable, it's like we're all on the same bus.
We're all humans. Yep. We all have stuff. Nobody's getting
We
out of the
all have
world
stuff.
unscathed. Yeah.
So it's, I do everything in my power to make it safe for people to do this kind of work.
Yeah. It's pretty wonderful. It really is. I wanted to ask you about, because I know you've got a couple things coming up on the horizon. You are part of the clinical trials going on at Roswell, correct?
Yeah, I happen to be on the Psychedelic Science Initiative Committee at Roswell, and I work as an outside consultant. And there are multiple clinical trials that are in the making or about ready to open. The one that'll probably open the first is expected to open in another month or so.
Okay.
And it's a trial sponsored by a company called Reunion, and it's a test of a drug that is a cousin of psilocybin. The generic name of the study drug is RE.
Okay.
And this drug has been tested for treating depression, postpartum depression, and has
Mm.
shown extraordinary promise. And the clinical trial that's coming up is looking at depression and adjustment reaction in people that have the diagnosis of cancer. And as I know that you know,
Mm-hmm.
it's probably impossible to get cancer without having trauma.
It's pretty impossible. I don't know somebody who's had cancer who doesn't struggle with that. Yeah.
There's
This is
trauma in the
huge.
diagnosis. There's
Hmm.
trauma,
The
in the
treatment,
treatment.
yeah. There's always a cost that it comes with, right? And
Right.
whether it's chemo, whether it's surgery, it's hard. There's not an easy path. When you hear that C
Yeah.
word, it's, a lot of people, just like we talked about dissociation earlier. I mean, I have that second set of ears ready, but
Yeah.
I wish that this stuff would have been around when I went through my cancer treatments. This would have been
Yeah. Yeah.
quite amazing.
Yeah. Well, long after the cancer's gone, you can be left with the effects of the
Yeah.
trauma.
Yep.
And so I'm excited about this trial, and I'll be
Yes.
one of the monitors for it, and be working with our partner Jenna
Mhm.
Witkowski, who's also one of the monitors, and Sarah
It's
Brothwell too, I think.
Oh, she's doing too awesome. Yeah. No, it's great. It's exciting to have this local, right? A lot of people will reach out to me and ask, where can I do this? Where can I go? And obviously some states things are legal and there's options, but to have
Yeah,
something local here in Western New York it's gold mine. It's gold. So I am really excited about this.
and me too.
Put a link for the clinical trial in the show description so
Okay.
people can have access to that. I'm also going to put a link to your website. So if people have
Well, thank
questions
you.
or interested in treatment, yes, I'm going to have them reach out to you. I feel like this is going to be so helpful for so many people. And it isn't there clinical trials for other disorders too? Because I feel like MS was one. ALS,
Yes.
there's a couple
So,
different.
yeah, that's right. This trial is also not only open for people with cancer, but also people with a diagnosis of multiple sclerosis and amyotrophic lateral sclerosis, or ALS, and Parkinson's disease.
Awesome. Yeah. 3,
Yeah.
no, 4 horribly horrific
Yeah.
things to go through.
And the trial will be open to those diagnoses as well, even though it's at Roswell.
Okay. Yeah. I'm hoping that this opens the door for more stuff. My hope is that these things go well and there's good results. I feel like just knowing what's already out there with some of this stuff, it's been very positive.
Yeah.
I know Jenna already mentioned a new Netflix documentary. I have not watched it yet. It's on my to-do list about Navy SEAL veterans and their work with
Ibogaine.
psychedelics. Yeah.
Yeah.
And, again, thinking of these guys being the toughest of the tough and still needing help. I think that also
Oh,
puts it in perspective. I think of myself as a peasant in the world, of just a normal person. And I went through things. So when you think of some of these people who do things I know I could never do ever in my lifetime,
yeah.
and them being willing to ask for help and being open to that, I think that is huge. We need more of it.
Yeah.
You also have a training coming up. I also wanted to mention that.
Yeah. Thank you for that.
You're welcome.
Yeah. Jenna and I are providing an online training in February, I think February 26, 27, maybe. I
Okay.
might have to correct myself, but I think that,
I have the flyer, so I'll make sure I link
okay.
that as well. So
Yeah. And this is training for therapists who wish to adapt ketamine-assisted psychotherapy, or CAP, into their practice. And so it's a kind of a gateway to be introduced to how it works and what it is that we do. And our plans are to follow that up with an experiential training there at our site in Amherst.
awesome. That's great. I'm so excited for what's to come. And I think you two are two of my favorites, obviously, in the field. And, we work together. So I'm a little biased, but I respect the work that you both do. and what you bring to the therapy world as a provider. It's special, it's different, and I know you care a lot about what you do. And doing this work, being a therapist for 12 years, being a patient myself at Roswell, when I work with cancer survivors, cancer patients, a doctor with an amazing bedside manner, feels like the connection component of what you offer to clients. That's huge. People want that. And, I remember going through my own cancer journey. And when I was starting to look for a therapist after I had gone through cancer twice in 1 year, I wanted a therapist who understood what I had gone through. And it was like finding a needle in a haystack. I did end up working with some wonderful people, but, I put my story out there in hopes that it resonates with somebody that is looking for that treatment that I was looking for. And I mentioned this a little bit when I had Jenna on, COVID has kind of changed that a little bit for us. We are allowed to be people. We are allowed to have stories too. And it's acceptable in the right dynamic to share things with people in the therapy realm to help facilitate therapy, to help facilitate healing, connection. And people want that. They really want that. And I always go back to a story of a woman early on in my field. I was interviewing for a job and she had wanted to know how many people knew I had cancer. And I'm like, well, my face is hanging on a billboard at the Ride for Roswell. So anybody who's involved in that might be seeing me. And I was active in stuff with Roswell at the time as well. And I wasn't ashamed of it. I think owning your story and your experiences, and if you can harness it in a way that helps people, there's so much power in that. So you being open as a provider and sharing your story and what got you to this place is everything. And I just want to funnel people your way because I know you really care. And it's
Thank
great
you so much for
to
that.
know you and to be able to work with you. And it's just awesome.
Well, it's definitely been an honor to work with you, and I have never been happier in my life.
You're where you're supposed to be. I do feel that.
I must be.
That day you reached out to me, because this is kind of how this all began. You had reached out to me and, it just kind of went from there, and it was my story. I think that's how you found me too.
Yeah, you're the first one. You're the first one I talked to in Buffalo when I started to look for a way to touch down,
Yep. Yeah. So I think things have a way of, I don't know. I think if we can go through hard things and we can come out and we can bring good things from those hard things, I feel like I don't want to go through it again.
Yeah.
But there's lessons that have been pulled from it and good things have been pulled from it. And that I couldn't ask for a better outcome.
Yeah. Yeah. And part of the outcome is all the people that you've helped who have felt identified with because of you sharing your experience,
Same thing. Yeah. I was asked once, I was on a podcast and I was asked once on how I got through that. And it was the people. It was the people who helped me and were there for me. And, my family doesn't live locally. So it was the friends, it was the people that showed up and decorated my room and brought a smile on my face. And we discussed, drama and, shenanigan chat and took your mind off things. And it was everything. So now I pay it forward by doing the work that I do today.
Yeah, me too.
Awesome. Well, it has been wonderful having you here today to do an episode, and I'm honored to know you and continue to work with you. And I can't wait to see the future and how that's all coming together. And I'm very excited about it.
Well,
I see lots of good things. Awesome.
Me too. Thank you, Mindi.
You're welcome. All right. Have a good night.
Okay. You too.
Okay. Bye.
Right.
Thank you for listening to this episode of the Unapologetic MidLife podcast. This episode is for educational and informational purposes only and does not constitute medical, psychological, or therapeutic advice. The Unapologetic MidLife podcast, MidLife Media 716, LLC, do not endorse or promote illegal substances. Psychedelic-assisted therapies discussed may not be legal, regulated, or appropriate in all locations or for all individuals. Always consult a licensed healthcare professional before pursuing any treatment. Listener discretion is advised.